Yeah, because your son, Braden, he was very little when he was diagnosed. Take me back to those early days. When did you notice something might be up with his health?
Well, Braden had just turned 3. We had noticed he's had excessive urination, occasional vomiting, and just gradually thinning it out and losing weight. And as you know, toddlers change so drastically that really the signs weren't really that prominent, but the excessive urination. And then we just thought, you know what, maybe we should just go to the doctor and have things checked out. And the doctor actually didn't believe he had diabetes either. And then lo and behold, Monday morning, we had a phone call that we were to report to Windsor Regional Hospital.
Why did you suspect it was diabetes? Was it because of the excessive urination?
It was, and I think a mother, you always have that thing telling you. And I think a mother always needs to trust that instinct that they know when something's wrong. And I think you always need to act on that.
Someone gave me advice the other day because I have 2 young toddlers, which you may or may not know. But they said, if you think something, you're right. As a mom, if you think something, you're right. And that seems to be the case in this situation.
It does. I think mother instinct trumps everything.
How did you know he was peeing too much? Could you give us sort of an idea of what that looked like?
I had actually had a lot of issues toilet training. And so he was still in a diaper, and that was just, several diaper changes. But I think even an older child, one trip to the bathroom is okay. 5 trips are cause for concern.
5 trips in how long?
Oh, I think especially in school, if, a teacher sees a children is going, 5 trips
Yeah.
in the course of, 5 hours, then there's an issue.
What do you know now when it comes to what symptoms there are beyond what your child was presenting when it comes to diabetes at a young age?
What other symptoms? I think irritation, being irritable. Of course, in a toddler, that's a daily occurrence without diabetes. I think fatigue, vomiting, irritability, weight loss, just, gaunt looking and dark eyes. And I think you feel something's wrong.
Yeah. And he was diagnosed at 3. What did daily life look like once he had that diagnosis?
Oh, daily life changed drastically. It was a new normal. I think it just called for a lot of discipline, a lot of structure in our day. Between finger pokes, checking blood sugar, and 4 to 5 injections daily, and just eating on a regular basis.
How did you communicate to him what was going on?
Well, he was 3, so he didn't really understand he had diabetes. He just knew that all of a sudden he had to stop playing and eat, or stop playing and have an injection. So I think it was gradual. He doesn't really remember a life without it. But it just became part of his life.
When did you bring him into the fold of his own treatment?
That was gradually. Just as he got older, I looked for signs for him to help taking on some of the responsibility, and maybe just being aware of how he felt and being able to communicate that to me. And then as he's gotten older, we've just gradually shifted some of that care to him. Even though he's 19 now, we still don't leave all the care in his hands.
Yeah.
And we still share that just so there's not a lot of fatigue.
That's what I'm wondering, how vigilant you need to be in those early years, and what the consequence is if you're not vigilant.
Well, I think you do need to be vigilant, especially throughout the night. The night can be, that's a long period of not knowing what their blood sugar is. So, I think with the technology today, we have a lot of glucose monitoring that can be done. So that's just been a game changer for type 1 diabetes.
What was it like? Did you put him in daycare at all, or?
Yeah, we actually, when he was young, I was fortunate enough that there was daycare right across the street from where I worked. So I was able to go over at lunch and just care to his diabetes.
Looking back, have you learned any lessons that would be helpful to other parents?
Oh, I would actually, I'd say the biggest thing is being organized, being proactive, and just being ready for, being prepared and being ready for all scenarios.
How would you properly transfer that control over to Brayden as he's growing up?
I think just gradually bringing in, first I think it starts for communicating lows and understanding that he has to think in advance before he exercises. Just be mindful of going low in for any emergency situations and being able to communicate that and communicating to other people. Other people need to be aware you have diabetes, just in the episode of an emergency.
Do children with diabetes wear an alert bracelet anymore, or is that even a thing?
Medical alerts are really important,
Yeah.
and a lot of children now are wearing insulin pumps.
Right. That's got to give you a bit of sense of relief knowing that in some way it's parenting and mothering him when you can't.
It is, and with the technology, with the continuous glucose monitor, that is received through his phone, and then we actually are able to view it on our phone as well, so it can alert us during the night or during the day. Even when he's not with us, we know what his blood glucose is.
Yeah. That's incredible that we've come that far.
Yeah.
Is it covered though, or did you have to pay for that?
We have benefits and it's covered, but there's a lot of programs through the government that
Can help assist with that.
it can, and it is a game changer.